small introduction to the stem cell and some of the work which I have carried at Jaslok Hospital, showing the stem cells, different type of stem cells which I have grown. You know, now if you see the stem cell class, it is a very brief idea. We am not giving complete idea, little bit idea about the stem cell classification. The stem cell generally are having a three types of stem cell. One is embryonic stem cell, which are mainly from the embryo, human embryo, which has got a lot of legal consequences. So most of the people from India, even I have not worked much on the embryonic stem cell because you have to take a lot of legal concerns and legal formalities has to be. I have mainly worked on adult stem cell and induced pluripotent stem cell because they are more easier, no legal complication, nothing we have to do. We have to just work on this. Now, these three types of stem cell, in which adult stem cell, there are two types. One is mesenchymal stem cell and another is hematopoietic stem cell. Mesenchymal stem cells are the cells, if you are working on the culture, you must be knowing the monolayer cultures. They grow in monolayer, mesenchymal cells. However, hematopoietic stem cells, they are suspension cells like blood cells, our lymphocytes, you know. So these are the two types of stem cells we have developed. I have developed these both here. I am showing you the pictures of those. And induced pluripotent stem cell is act like embryonic stem cells, but they are developed from the adult stem cells, somatic cells of their own body also. So this technology is also now developing very much and very much useful in working on the stem cell therapy, even in the HIV cases, because here also we can make the mutated induced pluripotent stem cell, which can generate the lymphocytes, which are resistant to the HIV. So this is also a better concept in this area. So as you know, totipotent, you must have read this. Totipotent is the embryonic stem cell, which gives differentiation in all cell types. Pluripotent is embryonic stem cell only, which is differentiated into cells from all three germ layers. Multipotent adult stem cells have mesenchymal and hematopoietic. I already explained you, differentiated in a limited lineage of the cells types. Oligopotent is adult stem cells like lymphoid cells, myeloid cells. They differentiated into limited number of cells and types. And unipotent is adult stem cells differentiated into single cell type. These will only show you the single type. Now, major property of stem cell, if you go and see, the stem cell have the self-renewal capacity. Means it gives duplication of the one cell. It is unspecialized cells. It comes to the two cells. One is stem cell, which remain like this, and another cell is getting differentiated in specialized cells. And this is a property called pluripotency. It is a very important property in regenerative medicine, because by this property, we can able to get the differentiation of these cells, whichever we require. If you want neuron, you can make a neuron. If you want cardiomyocytes, you can make it cardiomyocyte. If you want the chondrocytes, you can make the chondrocytes. If you want the insulin, beta secreting insulin, pancreatic beta cells, you can make it. I will show you some of the pictures on this, which in my laboratory already work on this. Stem cell work done from my laboratory. I have done extensive work in this, established basic stem cell research laboratory at Jaslok Hospital. The main aim and objective of my study was to grow and maintain the mesenchymal stem cells and hematopoietic stem cells from various cells and tissue, and study their phenotype and genotype to understand cellular and molecular mechanism action of that specific disease, as well as to find out, if possible, precise solution for therapies of these diseases. Now, one of the great advantage of stem cell research, it is a tissue culture. It is nothing but the tissue culture, but it is a more sophisticated tissue culture. You have to grow specialized cells from the human cells. Growing human cells is again one of the very tedious job, and it is not so simple also, but I was expert in from the beginning in this work. I have already told you, I acknowledge my institutions like National Institute of Health, where I have really done good work on stem cell tissue culture work, where 3D cultures have been developed. So here you have to take a lot of precaution to develop specific cells. I have worked in my specialized area of cancer, along with some studies in hematological malignancies, obesity, diabetes mellitus, infectious disease, and neurological disorders. Jaslok being a general hospital, I have also entered into the other areas and implemented my both the faculties like molecular medicine as well as the stem cell therapies in this area, and I got really lot of advantage in working on this area. I have developed mesenchymal stem cells, hematopoietic stem cell from patients, whole blood tumor tissue biopsy, adipose tissues, dental pulse cells, placenta, and cord blood cells. So I have taken almost all cell tissue. So whole human body, I can grow any cells, mesenchymal stem cell, any human part of the body. That much technology which I have done. This work contributed several publications in peer-reviewed journal, as well as trained more than thousands, 100 students for their dissertation work. Many of them are now completed their doctoral degrees from various universities in US, UK, UAE. Some of the institutes like Harvard University, NIH, Stanford, Cambridge, and so many things. So in Switzerland, so everywhere my students are working very well, and I am very proud that they have got training, initial training in my laboratory. Now here just I want to show and quickly go through this because we may have lack of time. We have to finish that. So I have developed first my paper in 2010 on working on the adipose tissues. Adipose tissue is a waste material to the body. Now the cord blood banking are coming, but I think now there is no need because we can develop mesenchymal stem cells or stem cells from any part of the body. So adipose tissues are the one of the best source for making the cells available for therapy. So there are a lot of advantages for adipose tissue cell, and this is a particular area. If you see, this is a lot of work on cosmetic surgery and many places this particular area is work. I have done molecular profiling to show they are mesenchymal stem cells, and they have the pluripotency genes, and as well as they have the mesenchymal and hematopoietic stem cell differ by my molecular markers in my laboratory I have developed. So this is one of the right. Then this is another publication is a stem cell is a defining molecular phenotypes of mesenchymal and hematopoietic stem cell from acute lymphocyte leukemia. Now this is acute lymphocyte leukemia is again one of the big problem in diagnosis and other things. But stems, if you look into the stem cell research area and stem cell angle, you can able to find out the basic phenomena, basic mechanism of this particular disease, which I got it. That time I was very new and I could not extend that work. Actually, when I got this cells culture into a culture, I found some of the MSCs, mesenchymal stem cells. These are mesenchymal stem cells, and these are hematopoietic stem cells. Now, it is nobody knows that the hematopoietic stem cell which are generated from mesenchymal stem cells, that as was clearly seen in this area. These cells are generating hematopoietic stem cell, and the growth is very excessive. In one day, you complete this dish with all these lymphocytes cultures. These are the pictures, and these are the markers which are required for identification of this, and this is done in my lab. I'm just showing this is basic concern with the HIV transplantation. Also, we are very say this particular area may be essential for our HIV and stem cell therapy. Now, this is a differentiating with the skin dermal cells. I have differentiated in the various cardiomyocytes and shown that they are making the cardiomyocytes. These are marker for cardiomyocytes, and these are the basic markers for the stem cell pluripotency marker and mesenchymal stem cells. Now, dental pulse cells. I think Ritika was very much interested in thinking about the dental pulse cells. This was extraordinary work which I did in lab. One of the students whose sister was dental physician, and she gave us a dental teeth for work, and we have developed this thing. And important thing is now whole company. I think this is name I have forgotten. I am on the IC committee on that. That is name is forgotten the name of this company. They have full work on dental pulse cells, and this I have shown that they are differentiating into the live neuron. They are differentiated into the cardiomyocytes. They are differentiated in the adipocytes, and they are also differentiated in the beta cells, which are secreting insulin granules. You can see here, these are insulin granules. Insulins are secreting. So this type of cells, if you inject into the diabetic patient, there may be a possibility of reducing the sugar or have some therapies to the diabetes. So these particular dental cells can be used, and possibly I have got an invitation for one of the dental meeting in Amsterdam. I will do on webinar only. I cannot go there because of the COVID problem, but most probably I may be presenting this work there also in that meeting. So this is the dental pulses. And now this is a from the solid tumors, breast cancer tumors. Here also we can get a breast cancer tumors. You see the breast cancer is how we understand the mechanism of this thing is that there are mesenchymal stem cells, which are the cancer stem cells. Uh, there are two different types of cells, one cancer cells, cancer stem cells, and pluripotent stem cells. So these are different type of cells I have already isolated. This is a big program, and I want to very proud to say that my pictures are on the cover page of the Stem Cell Discovery Journal, which is journal published by the MD Anderson Cancer Center, who is the editor is from MD Anderson. He's a big person in MD Anderson. Now here you see these are the pluripotency clone. These are the spheroids. Now you know recently the organoids has come already. You know, organoid research and organoids are going to make the organs actually live organs in that work is going on. So I have done work up to this area. Only I have to put it in the scaffold and then further go for this particular making the organoids. So this is one of the things which I want to show in this area. Now these are the same which I already talked to you. Now coming to the induced pluripotent stem cell, I have already told induced pluripotent mainly developed by these two scientists. They are really great people like Gordon and Yamanaka from Japan and Cambridge universities. They got a Nobel Prize in 2012 for doing that, making the induced pluripotent stem cells from somatic cells. Somatic cells means what? Our general fibroblasts. We can use the general fibroblasts for our work and make it into this fashion. We have to make some transfection of this pluripotency gene like pluripotent. I have shown the pictures. I have not explained that you. There are four genes like SOX2, OC4, 9OC, and KPL1. These are the genes gives the pluripotency. Means they give the cells become a stem cells, and these cells, these iPS cells, also can give rise to the any type of cells. These cells can also be engineered to give the different type of generation of the cells. So this particular technology also will be very much useful in making lymphocytes, B lymphocytes, CD4 lymphocytes with the different mutations. So this will be also one of the extended research. And because of this person and then the Dr. Carpenter and Dr. Donda, who got a Nobel Prize in CRISPR technology, CRISPR-Cas technology, which allow us to make more easier way of making gene editing. So see how the development of this particular technology are making us a lot of innovations in our work, and only scientists has to have that view for that. And I was doing all these trials in my laboratory, and that's why most of the work was very, very positively done. Okay. So how the innovation in the stem cell therapy helps in future therapies of various diseases? So common questions, I have just put it into this. Innovation in gene and protein replacement technology are the novel approaches now available to treat the selected group of various disorders. You know, there is a mutation or there is some deformity in the protein or degraded of protein or making an improper protein signaling pathways and other things. So if you correct it, that can be done, and that can be better way done in the cells which are grown in the cultures. The advantage in stem cell research, such as making an induced pluripotent stem cell, which I have just now talked, and they are also making lot of importance applications in the making cells to use for the therapy. This technology now supported the discovery of genome editing. Now I just told you about the CRISPR-9 technology, which is also helping us to very simply editing the chopping the gene or addition of the gene become a very easier because of this technology. And this is a really novel work, and they got this Nobel Prize in 2020. So the discovery allows us to think about innovative therapies for monogenic disorders affecting single organs or tissue in different orders. So we can do this all work because of there is a lot of innovation, technological help we have done, and stem cell research is the base for this. You can't do this. These are all in vivo, in vitro studies, and put it into the in vivo situation. So this you must have the master mind in this particular technology.